Now, I'm pleased to introduce our next segment today, Bridging Data and Policy. While governments at all levels are determined to make decisions and set policy that is evidence-based and data-driven, challenges do remain in data collection, sharing, maintenance, analysis, and communication. Public trust in the provenance and transparency of data poses yet another obstacle to bridging the data policy divide. Our panel this afternoon represents experts in data governance, education policy, and municipal management, who will share their experiences and approaches to bringing data to bear on decision-making at all levels of government. Our moderator today, Claudia Schultz, is the Director for Research Development, School of Data Science, where she supports faculty and students in interdisciplinary research efforts, ranging from student capstone projects all the way to NSF and NIH-funded projects. Joining Claudia as panelists today are Yeri Kumala, Data Scientist at Open Lattice, Carlos Rivero, Chief Data Officer for the Commonwealth of Virginia, and Daniel W. Player, Associate Professor of Public Policy at the UVA Frank Batten School of Public Policy. Please join me now in welcoming to the Zoom stage, Bridging Data and Policy.
Hi, everyone. Thank you, Allison, and thank you to Oracle for Research for your support of today's event. My name is Claudia Schultz. I'm the Director for Research Development at the School of Data Science at UVA. I'm not a data scientist, but like much of the public, 2020 has turned me into something of a data fanatic, right? Many of us are chatting about COVID test positivity rates over the breakfast table. Maybe we're debating polling errors as we wait for our curbside grocery pickup. So data is has become more and more prevalent in the media, in our own understanding of the world. And as a result, it's often conflated with that awful term, fake news, right? So public decision makers are using data and trusting data to inform decisions about what is best for the public, but also increasingly having to defend the provenance of that data, having to defend the use of that data and its legitimacy in their decision making. So today we have some great speakers to share their views and their experiences from various sectors and various purposes of that intersection between data and data creation, data collection, and policy and decision making. I'm really, really excited to hear from all three of them today and from all of you. I hope you will use the Poll Everywhere link to submit your questions. All three of our speakers today are not using slides. They're going to speak from their experience, and they're going to speak for a very short time so that they have time to sort of have some crosstalk with each other and to answer all of your questions. So I'm really excited that everyone is here, stuck it out all afternoon to view this panel with us, and I'm really grateful to our speakers for being here today. And so we'll go first to Yeri.
Hi, everyone. I'm excited to kick off this panel about bridging data and policy. I've had the opportunity to work across 5 different cities on different data sharing initiatives aimed at improving policy, identifying need, or improving program effectiveness. So today I'm just going to share some examples of those initiatives that I've worked on, speak a little bit about the power of data sharing and some of those challenges that you typically find. So speaking of the different cities, I'll start with Raleigh, North Carolina. When I worked in Raleigh, North Carolina, I worked with the Healthy Environment Collaborative, and that was aimed at informing policies that affected the built environment and creating systems to make it easier to conduct health impact assessments. Health impact assessments are based off of environmental impact assessments and are very data heavy. It involved about 4 to 5 different state level agencies. It was aggregated data, so it was a little easier to share, but it required a lot of collaboration and really thinking through how can you effectively and consistently share information together. In Baltimore, Maryland, when I worked in Baltimore, I worked on helping develop their city violence prevention plan and incorporating elements of a homicide review board, which are based off of fatality review boards that are found often in the public health arena. And so that actually involves in-depth medical, social reviews, and just brings about a number of city partners as well as local government entities. And that kind of effort required a lot of individual level data sharing. So that's a lot of private information. And we hadn't found a lot of ways to do that effectively. And so think about old school data sharing. We actually would end up sitting in a room together and manually sharing information and figuring out the best way of linking that information. So the opportunity there was really trying to think about it strategically about how can you automate some elements of data sharing, but also think about it how you can improve the process. In Washington, D.C., I was part of reducing risk-taking behaviors in teens. And so worked a lot with your high schools and middle schools. And that initiative focused on bringing a lot of local partners together along with the school system. Similar to Baltimore in certain ways, there was a lot of individual level data sharing, but unlike the other place, we tended to aggregate it to the zip code level or school level so that we didn't worry too much about data privacy. But something that's been consistent is the struggle of figuring out where do you keep that data? How do you link that information? And how do you really maximize the impact of bringing all these different partners to the table and really being able to think about prevention and being proactive in using the data that you're getting, but how you can use that information to make impactful decisions. In Cincinnati, Ohio, I worked with the Collective Impact on Health Initiative, and that was the first time I wasn't working from the government perspective, but I worked with the United Way of Greater Cincinnati. And that Collective Impact Initiative brought local and state health departments. It brought big funders together, hospital systems together. And the focus of that initiative was on identifying the gaps that existed in the region with the aim of improving the health and wellness of individuals in that community. Unlike some of the other initiatives I had worked on, they were able to fund an organization that would serve basically as a backbone. A backbone is an organization that would set up all the systems and processes and tools for gathering that data from all these different entities, synthesizing that information, and then being able to share it out. So they really helped in organizing us and housing that information and thinking about how we could use it to really answer these different strategic questions that we had, but the focus on deploying resources effectively. And lastly, I'll give you my last example in terms of cities I worked with is Denver, Colorado. I worked on building their first health equity report. Similar to some of the initiatives I'd worked in the past, this was very targeted in terms of it brought a number of state agencies together with one focus is to determine health disparities across the state of Colorado, think about how you deploy resources, how you engage communities, with a larger vision ultimately of being able to do that more consistently and create dynamic ways of using the data. Most of the initiatives I worked with were focused on informing policy and really thinking about strategically deploying resources so that we could be more effective. As many of you who are here today know, data has become the backbone to decision-making. So we all know how important it is for making decisions and how important it is for people to come together and share the right kinds of information to be able to paint a more holistic picture of need, get a better sense of the problems, especially when you're thinking about local state government. The challenge is that it's not always as easy bringing all these different stakeholders to the table, but also thinking about what the shared goal and priorities are. Data sharing is great, but it is essential to think about all the different elements that need to be in place. If you do not have clear priorities and a clear agenda of how you want to use the data and how you want to leverage the data, it can be much harder to accomplish much about bringing all the data together. There are lots of initiatives out there like open data that allow for lots of entities to put their data and make it accessible to all. But what can be even more difficult is when you're dealing with private data. So individual level data or data that is internal to a department, but could be very impactful to sharing. And so a lot of the challenges is figuring out, you have to build into trust needed, building the relationships, thinking about data sharing agreements, data confidentiality, security, warehousing, and the list goes on. And so it can be a little slower when you're working really large institutions, aka government. And so it's really being able to think about how strategic and focused you can be about why you're coming together to share data and what you're trying to accomplish with that. The smaller the chunks, I think the quicker you can move. And that's one thing I noticed with some of the work that I had done. It's also always easier to work with population level data. You can move a little quicker, but also same issue, you have to think about what are you trying to do with that? Because now that data is also readily available. So some people are like, what's the point of necessarily coming together and be really, really intentional about it? When I think about data sharing, there's also a quote from Nathaniel Smith from Partnerships for Southern Equity that I really liked because it's about how you organize information. And the quote states, a lot of people focus on organized money and organized people, but organized information is another key pillar to building power in community. So when we think about data sharing, especially about from the policy level, we think a lot about these larger institutions that are working together to move policy and these large level initiatives. But also it's essential to make it easier and accessible for all those that are interested in that information to be able to leverage it and also use it to make decisions. And so that's when you start thinking about data democracy. And so those are some of the important elements I've noticed. Data is key to decision-making, uncovering opportunities, and sharing impactful stories. And the more we become really intentional about it and find effective and efficient ways of doing that, the greater impact we can have. So I'm lucky now to work for a small startup, and their sole focus is on figuring out how to standardize information, make it easier to link, especially like private data across local and state government. And those are my tidbits right now, and I'll pass it on to the next panelist. Thank you.
Thank you, Ari. This is Carlos Zuberl from the Commonwealth of Virginia. I'm the Chief Data Officer, and I've been in this role for about 2 years now. And looking at, and I'm glad you talked about data sharing and trust, because absolutely critical, right? Trust is the most critical component of any data sharing relationship. But before we get into data sharing and analytics, we have to talk a little bit about governance, right? We have to govern our data assets, and we can't call it a data asset if it's never been inventoried. So I'll get into a little bit of that later. But when we talk about data governance, they're really talking about three primary benefits. Number one is improving operational efficiency. Now, as a Commonwealth of Virginia, right, we are a very large organization. We have over 100,000 employees. We have annual revenues of over 44 billion. We have 63 executive branch agencies that I'm responsible for, 133 localities that each operate independently, but operate under the auspices of the Commonwealth of Virginia state government. So there's a lot going on in state government. As such a big organization, improving operational efficiency is a key component for why we implement data governance, why we want to support data sharing, and ultimately why do we want to drive data analytics. But beyond operational efficiency, we also have more citizen-centered services. We want to be able to provide our citizens with as many government services that are going to be helpful to them, especially those citizens that are underprivileged or vulnerable populations, right? We want to be able to support those constituents that are suffering the most within our society. But even more than the services that we offer, we want to make sure that we provide better outcomes for our constituents. And there is a big difference between the services that we provide and the outcomes that our constituents experience. And being able to bridge that gap and document when our services support specific outcomes is a key component of data sharing. We want to be able to link the data assets that we have that document the types of services that we provide to the outcomes that our constituents are experiencing. And a good example of that is the Department of Social Services, where, service is in its name, right? It's providing a variety of different social services to our constituents, but they don't always know what those outcomes are. Sometimes the outcome is very positive and you get a great paying job. Well, if you do get a great paying job, that data is collected by the Virginia Employment Commission. They document from the unemployment insurance claims and unemployment insurance wages what individuals within the workforce are making in the different roles that they have. And that's all obviously PII. but it is connecting back to different social services if you ever received a social service from the Commonwealth, but you don't necessarily connect that outcome to those services until those two agencies share data. Another example of this, which is not a more positive example, but it's still an example of an outcome, is that you become incarcerated and become a member of either our jail or our prison system, right? And in that case, that is either the Virginia Department of Corrections or our local and regional jails. And they don't necessarily share their data with the Department of Social Services readily, right? So how does this Department of Social Services be able to connect those outcomes to the different services that providing to determine whether or not those specific services are contributing positively or negatively to an individual's life? Now, mind you, there are other factors involved, granted, but the reality is that we do provide many, many different types of services, and those services do have an impact on the outcomes of our constituents, and we need to be able to bring those two together. And that's where data sharing plays a critical role, is being able to tap into all of these different data assets that are managed individually and autonomously by the multitudes of different executive branch agencies within the Commonwealth, but then bring them together under one umbrella to be able to leverage those data as strategic assets. But before I get into all the different initiatives and governance and trust and discovery and talent and all that wonderful stuff, we need to talk a little bit about the data value chain. How does data become intelligence, right? Because it doesn't just happen overnight. It is a very methodical process of how data evolves from information to intelligence. And when you talk about data, you're really just talking about bits and bytes in a computer system, right? Something that's a binary representation of what's happening in the real world. But that data doesn't become information until someone with a specific perspective interprets that data within that particular domain, whether that domain is healthcare, education, environment, criminal justice, what have you, right? Everyone has a different perspective from which they view the world. And when you look at the different data assets that we have, those bits and bytes that are in those computer systems, they take on a different meaning depending upon the different perspective that you have. And that information becomes knowledge when you start to understand what are the patterns and trends associated with the data that you're seeing, with that information that you're interpreting, right? So, you collect data, but then you interpret that data for it to become information. And then you assimilate that information by understanding the patterns and trends and mechanisms that are creating that representation, those data assets that you have. But then ultimately, if you integrate that knowledge into your decision-making framework, then it becomes intelligence. And so when we talk about data sharing, we're talking about multiplying that data value chain, because the data itself doesn't change, right? The bits and bytes that are in that computer system doesn't change if you all of a sudden share it with the Department of Health or the Department of Medical Assistance Services or what have you. Those basic data elements don't change, but what changes is the perspective by which those individuals are looking at the data. So the observer in this case is very, very key to the whole process. And then that observer generates their own knowledge, and then they then implement that knowledge or integrate that knowledge into their decision-making framework, thus becoming intelligence. So the more you share data, obviously the more valuable it becomes, because you're creating more of these data value chains. So having said that, the 4 initiatives that I've been primarily working on since the beginning of my tenure with the Commonwealth have been first and foremost establishing governance, creating an environment where the different individuals and the roles that they play come together to participate and engage in the governance discussion. And governance is exactly what Yeri was just talking about. It's building relationships, having individuals sitting around a table to discuss what's going on with our data assets, how do we leverage them strategically, and how do we improve upon our ability to leverage those data assets. And starting at the very bottom, we talk about data stewards and establishing a data stewards group, so that from a technical perspective, we can get a better understanding of how data flows within the organization. But then we also have the Data Governance Council, which determines who gets access to which data assets, right? They're the individuals that are really responsible for making sure that access to specific data assets is only provided to those individuals that merit that type of access. So it's got to be secure and it's got to be appropriate. And she also mentioned open data, right? Open data is critical, but is not the end all be all of data sharing. We have a lot of restricted use data. Data is classified as sensitive, whether it's for confidentiality, integrity, or availability. There is a sensitivity associated with those different data assets. And as a result, they cannot just be freely shared. There's a very measured approach to sharing those data assets. And that's where the Data Governance Council comes into play, making sure that only those individuals and those organizations that should get access do get access. But above the Data Governance Council, we also have an executive data board staffed by the different executive leadership of all of the different agencies involved in the Commonwealth Data Trust, which we'll get into that a little bit later. But when you talk about the executive data board, you're talking about individuals that are the heads of their respective agencies that are making decisions about what resources to allocate to specific data projects, what obstacles need to be removed, whether they're political, organizational, or resource-based, and then also what policy standards and best practices they want to adopt and implement within their specific organizations. As a chief data officer for the Commonwealth of Virginia, I don't have the authority to demand or mandate that any specific employee of the Commonwealth do anything, right? I don't have that authority. That authority belongs to the executive whose agency they work for. So as a result, we really need this data governance process to, through the Data Governance Council, identify and recommend different policy standards and best practices that we as a Commonwealth need to adopt to improve our data governance posture. And then we then recommend that to the executives on the executive data board to say, these are the things that we need to implement in order for us to improve our ability to manage our data. And then through that executive data board, they collectively make the decision to whether or not to adopt or modify and then adopt these different standards, policies, and best practices that are then pushed down or cascaded down to their respective organization for implementation. And then lastly, we have the Virginia Data Commission. Now, this is an overarching organization that really plays a key role in identifying what large-scale Commonwealth-wide goals and objectives we want to tackle things like 10% reduction in overdose deaths, improvements in infant and maternal health, reduction in recidivism, improvements in workforce readiness by high school seniors or individuals in college, right? Looking at these overarching, wide-scale, complex, multidisciplinary goals and objectives that any one agency really doesn't have the purview to solve. It's really a combination of different agencies. So looking at the Virginia Data Commission to identify what are some of these multidisciplinary complex problems we want to address, which are the agencies that are most aligned with addressing those problems, and then translating those that mandate to those agencies to then, from the executive data board, be able to translate those goals and objectives to agency performance standards or performance measures that they need to implement, right? Because at the agency level, they have a very limited purview of the business processes that are associated with any particular issue. And I'll give you a great example. When we talk about overdose deaths, right? We talk about opioid-specific overdose deaths, right? When you think about overdoses and opioid-specific overdose deaths, the Office of the Chief Medical Examiner provides that data on a regular basis. They can tell us how many individuals are dying as a result of opioid overdose, but they don't have any of the business processes that actually move the needle in any direction, right? They're just reporting the outcome. They're the messenger, but they're not controlling how those different business processes are contributing to the problem. But which agencies are? Well, the Department of Juvenile Justice, the Department of Corrections, the Department of Health, the Department of Medical Assistance Services, the Department of Behavioral Health and Developmental Services. There are multiple agencies that are involved in one way, shape, or form in some aspect of the overdose epidemic, right? And so being able to bring those different agencies together, provide them with the problem that we're trying to solve, and say, okay, now from your particular perspective, how are you going to address your specific component? And then come together, share those data assets together, be able to build in the analytics and the models to help determine what are the mechanisms that are at play of allowing or facilitating the opioid epidemic to continue to foster and be within the Commonwealth of Virginia, and then what levers do we need to pull to be able to mitigate some of those issues, right? And be able to provide services to our constituents that are going to mitigate the impact of the opioid epidemic on our communities. And so that's what it's all about, is making the Commonwealth of Virginia a much smarter organization by iterating through this process, and governance plays a key role. And again, earlier I talked about data being an asset, a strategic asset, but it's not an asset unless you inventory it. So a big part of one of the things that we're working on is discovery, making sure that our data assets are discoverable. And a big part of that is data documentation. Now, I joke when I say, data documentation is a great thing for someone else to do, right? And we all feel that way, right? As we work on our operational environments and we're constrained and we've got so much to do and so many things on our plate, documenting our data assets isn't one of the things that's on the top of our list. However, if we want to be able to leverage our data as a strategic asset, it has to be well documented. People have to be able to discover the data asset, but more than discover, they have to be able to understand what it means and where it can be best used. It has to be fit for purpose. You can't just take data off the shelf and use it for anything. It has to be fit for the type of purpose that you're implementing. And that's where the data documentation process really plays a key role. So we're leveraging not just a cloud-based environment to manage our data catalog, but also creating a process by which students and apprentices and vendors that are working on business intelligence and data analytics projects can contribute to the data catalog, can participate in the data documentation process. So it isn't all on the agencies themselves. This is something that everyone can play a role in being able to better document our data and make sure that it's discoverable and understandable across the board. And I'll get into talent in a little bit when I talk about the Rural IT Apprenticeship Program and the Commonwealth Data Internship Program. But before that, we get into trust. And Yeri mentioned it, and this is absolutely a critical component. You cannot have a relationship without trust. And the Commonwealth Data Trust is one of those key elements that we've created to be able to facilitate data sharing across the Commonwealth. And historically, we've had a lot of point-to-point sharing between different agencies, and we're doing away with that by implementing the Commonwealth Data Trust, which I'll talk about in a little bit later. But before I get into the data trust in more detail, talent development, data talent development specifically within the Commonwealth is incredibly important, especially as we try to leverage data analytics, business intelligence, machine learning, all of these wonderful technologies, but they have a place within the business processes of the organizations. And if there aren't individuals that understand how those technologies are best utilized, it's useless, right? The technology itself doesn't mean anything. And so we need to be able to develop and cultivate that data talent across the Commonwealth. Well, first thing we're doing is creating web-based training for all of our employees to understand data governance, Power BI, different types of intelligence capabilities, different types of analytics. So we are taking a proactive approach in being able to educate the employees that we already have, but we're also looking at bringing in students from across the Commonwealth, from all of our different academic institutions, whether they're participating in the Commonwealth Data Internship Program, which is a matchmaking service that we have that connects students and research faculty at academic institutions to agencies that have data and problems that they need to solve, and be able to bring those two together to give the students not just professional experience dealing with real world problems and real world data that's not 100% clean, that has a bunch of data quality issues that we need to address, right? Things that you don't see in the classroom, you see in the real world. And that's what we're trying to bring, that experience to the students so they can come out with, when they come out of college, they have on their resume, I did this work for this agency. And they can clearly document, their marketability with regards to the skills and talent that they possess. But in addition to that, we're also leveraging the Rural IT Apprenticeship Program, which is a partnership that we have with the Southwest Virginia Higher Education Center to develop an apprenticeship that gets individuals that are coming out of high school, not necessarily in community college, not following through with any college plans yet, but really interested in understanding and learning more about data and being part of the data world, looking at documenting our data assets, working within our data documentation process to fill in our data catalog and be able to leverage the different tools that we've made available to do data documentation work for us. Now, talked a little bit about Commonwealth Data Trust, and the Data Trust is nothing more than the legal framework that identifies the roles and responsibilities of all of the entities involved in a data sharing relationship. Now, Yeri mentioned relationship, and it's absolutely true. This is a relationship, and there are different entities in this relationship. The first entity is the data provider, and in our Data Trust, we call that the Data Trust member. They are the organization that's providing data into the data trust for other organizations to use. Now, just because they're providing data into the trust doesn't mean it's automatically available to everyone. It's a trust, not a commons. In the data commons, you're introducing your data to the larger community, and then everyone has equal access to that data. That is not what this is, because we're talking about restricted use data that needs to be governed and needs to be access to it, needs to be controlled. So the Commonwealth Data Trust is really a vehicle for agencies and other organizations, including some private organizations. We'll talk a little bit about that in COVID-19, but private organizations to be able to provide data into the trust and then exercise their authority and control over those data assets by determining who gets access to what, when, right? And so the trustee, the Office of the Chief Data Officer, plays a critical role in being the entity that's responsible and accountable for making sure that only those organizations that should have access do get access, right? And then another entity in the relationship is the data recipient. And in this case, we call the data trust user. That's an organization that has been given the approval by the data trust member to have access to their data, right? So they also have to sign an agreement certifying that they understand as an organization that they have certain responsibilities for protecting the data that they've been privileged to access. And then lastly, we have the individual data trust users. Those team members of those data recipient organizations that have their hands on the keyboard, eyes on the data, that are working with that restricted use data on a regular basis. They also have to sign a non-disclosure agreement, personally certifying that they understand their responsibility to make sure that that data remains private and confidential, right? Because the data that we're providing is very privileged data, and it should not be made available to any other organization in any way, shape, or form beyond the scope of the project that you've been approved. So that's the Commonwealth Data Trust in a nutshell. And what we've done is we've created, well, coming into this position, the General Assembly mandated that I work on an opioid pilot project, right, to demonstrate the value and efficacy of data sharing and analytics to solve a complex problem. And that problem was opioids, right? So we worked with the Department of Criminal Justice Services, Department of Behavioral Health and Developmental Services, and our vendor partner, Clarion, to implement the framework for addiction analysis and community transformation in the Winchester community of Virginia. And that essentially is our pilot project to demonstrate not just the value of data sharing, but how to do it effectively, creating the data trust, creating the data governance framework, implementing a cloud-based data consolidation environment where we then build out the analytics and the intelligence that then gets fed back to those communities, to the community leaders that are making those decisions at their particular locations, right? Because at the end of the day, the FACT project is not about making state data available to state users for state policy goals. It is about empowering community leaders to take action in their communities, right? Because that's where the solutions are going to happen. And we're not going to solve the opioid epidemic at the state level or at the federal level. It's going to happen at the community level. And we need to empower our community leaders, our law enforcement, health services, community services, faith services. All kinds of different organizations are involved in addressing the opioid epidemic, but we need to be able to empower them with the data that's collected across all of those organizations to get better insight as to what's happening in their respective environments. And that's what the Data Trust and the FACT project was meant to do. And some of the impacts that we've seen in the FACT project as we've tested out these different components has been identifying an age of first use, looking at the different types of substances that people are using at different ages and determining whether our outreach efforts are enough. You know, and in many cases, the outreach efforts were really focused at the high school level. And we've realized that in many cases, because of the data we've been able to collect, a lot of these individuals are starting to use drugs, especially marijuana and alcohol, at like 13 years old, right? So that really shifts our outreach to a completely different level. And we need to make sure that we address that. But in addition to that, it also allows us to look at drug intensity. What is the age of first use to the age of first interaction with law enforcement? What does that look like with regards to the individuals and the different substances that they are involved in? And you can definitely see from the data that we have that, you know, there are significant differences between alcohol, marijuana, cocaine, fentanyl, amphetamines, right? Each of those different types of substances has a different drug intensity associated with that. So it kind of gives you a very clear indication that, you know, no drug is exactly the same as the other. We have to treat them as individual types of societal impacts because they do have a variety of different societal impacts on our communities. But having leveraged that, we want to be able to, you know, look at the FACT project as kind of a microcosm for the larger scale Commonwealth. And so what we started to do was take that data governance model that we established in the FACT project and scale it out to the Commonwealth, which is what I talked a little bit about earlier. We're talking about the Data Stewards Group, the Data Governance Council, the Executive Data Board, as well as the Virginia Data Commission, but then also the Data Trust itself. We also had to scale that out. Not only did we work with it in the FACT project, but we also implemented a workforce project with that, where we implemented a data trust. And from that, we also learned that we needed to tweak it a little bit, working with the Office of the Attorney General to really build in that legal framework that allowed us to bring on additional partners. And that was in perfect time because as we were finishing up the data trust legal framework, that's when the COVID-19 pandemic hit us. And so as a result of that, we were able to onboard private healthcare association to bring in data assets from all of the different hospitals. We're talking about 115 different hospitals and healthcare systems across the Commonwealth to provide information about the number of beds that are being used by COVID-19 patients, number of ventilators, the number of ICU units that are being used, how much PPE they have on hand, are they having any difficulty obtaining PPE? And at the very beginning of this crisis, we were able to leverage those data assets to make data-driven, very informed decisions about how to best respond to the pandemic. And is our healthcare system being overwhelmed by the number of COVID-19 cases that we're seeing? And thankfully, we were not being overwhelmed, and we did not have to spend additional resources on setting up alternative care facilities in some locations where we thought we were going to need those facilities. And that would have been an intense expenditure for the Commonwealth to be able to stand something up in a very short amount of time. But because we were able to bring those data assets in, we were able to shift our focus from standing up an alternative care facilities to, are we conducting appropriate testing across the Commonwealth? Where are we conducting this testing? To what populations are we hitting? And then being able to look at, the different types of testing that we're doing, whether it's, PCR testing, antigen, or serology, which ones are the most indicative of what's happening across the Commonwealth? And then are localities adequately testing in each of their different jurisdictions? Because that's the other thing. You want to make sure that all of the different localities are testing to meet a certain requirement. And when HHS, the federal agency that was responsible for the CDC, set out those guidelines that, at a minimum, you should try to test 2% of your population per month, 4% of your population. We were able to meet those by setting up those metrics.
Carlos, can I ask you to pause so that we can have Dan share his thoughts, because we have a ton of audience questions coming in and we do want to leave some time for those as well. So I really appreciate all of these experiences and this wealth of knowledge that you're bringing. And a lot of the questions are addressing some of the things that you're bringing up right now regarding COVID. But I want to give Dan a little while to share his perspective so that we can look at these questions, especially the ones that have been submitted during your remarks. I want to remind the audience to please go to the Poll Everywhere website and upvote the questions that you're most interested in, because that will allow me to more efficiently relay these to the speakers once Dan has finished sharing his remarks. So thank you everyone. Dan, the floor is yours.
Okay, great. Thank you so much. And I hate to stand in this awkward position of being between the audience and their questions for Carlos, so I'll try to make it brief. I just wanted to first start by thanking the sponsors and the organizers of this amazing event. It's been such a great nerd fest in such an amazing way. So thank you for that. This is terrific. I also want to thank my fellow panelists for their invaluable perspectives. I'm just going to take a few minutes and talk from my perspective as an academic researcher. And as Carlos stated, the goal for us is to take information and create intelligence. I hadn't heard it stated so nicely, but I think I'm going to put that on my business cards from now on. I'm coming from a background in education policy, so that's going to shape my comments, but the principles I'm going to discuss apply to a lot of different fields. So in my field, many of the most pressing questions are centered around how we can make choices at the school, district, or state level that will maximize educational impacts for all students, but particularly for students who have historically been underserved by the public education system. But we also live in the world of the reality of economics, and we know that if we make decisions with limited resources, then resources we spend towards one activity means that we're not spending resources on something else. The challenge that we face in nearly every area of social science research is that we know outcomes are shaped by dozens of factors. And for decades, researchers have wrestled with how do we answer these questions in a way that we are confident that we've isolated the thing that we're the most interested in. So just for example, if we were to just look at schools across Virginia, we would see that some have more students passing the SOL test than other schools do. And can we then therefore conclude that they have better teachers? Maybe, but probably not. We probably can't be comfortable concluding that because there are so many things that contribute to whether a student passes an SOL test. And this has been a challenge. This will continue to be a challenge in policy research. It's one of the reasons we have jobs, so I'm grateful for that challenge. But one of the most important developments in education research over the last 20 years, and I think if you talk to other researchers who do the kind of work that I do, I think we would agree that the establishment of state longitudinal student data systems has been critical. These are data systems that allow us to track students and teachers over time for many years. North Carolina and Texas were two of the first states to make these sorts of data systems available to researchers, and they continue to have very robust databases that enable researchers to improve our ability to answer these questions in hopefully a causal way, to be able to see, if I do this, do I get better outcomes for my students? Both of these states organize a central repository that connect many disparate elements of data systems into kind of a one-stop shop for researchers to access in a uniform manner. North Carolina and Texas do it differently, but both have served as effective models for other states, including Virginia. And over the last 10 years, many states have established similar longitudinal data systems. I'll spare you the details on the mechanics of how we feel more comfortable being able to use these sorts of data systems, but I would also encourage you to enroll in a course or two that will help you to explore these on your own. But in essence, when we're able to follow students, we can see really interesting patterns of when they go in and out of different teachers' classes or in and out of different schools. We can account for things that we otherwise can't account for by just looking cross-sectionally, or looking at a snapshot in time of schools or an education system. I just want to highlight a few of the things just over the last few years that we have learned, and some of these might seem obvious, but these are things that we've learned through longitudinal data systems. So one, we've concluded that teachers are the most important school level factor in determining student achievement. And we've also learned that some teachers are better than others, and that difference persists over time. So it's not a transitory thing that they're good this year and then they're not good next year. Also, there was a series of papers published a few years ago that made a big splash in our circles, showing that having a good teacher has long-term economic benefits into adulthood. That can only be answered with longitudinal data looking over time. We've also learned some sort of negative things. One of those is that in some schools, this is not in Virginia, but in other states, they've documented that students from disadvantaged backgrounds are more likely to be assigned to novice teachers who have less experience and are often less effective. We also recently, there's a study that just came out showing that teaching assistants have a positive impact on student learning. So if you're in a classroom with a teaching assistant, you do better than if you're in a classroom without one. They've also allowed us to look at things like hurricanes, like how does that affect student learning, and how does that affect student learning in the schools where the students now are being displaced to? And give us a couple years, we will tell you how much the pandemic has affected students, and we'll be able to tell you not only that, but who has been disproportionately affected. So those are just a few of the findings that longitudinal data systems have allowed us to do in the United States. There have also been some really impressive studies that are ongoing about non-educational outcomes, looking at things like income mobility. There are also, if you are interested in international research, longitudinal data systems have allowed people to look for, there are some countries that have generations of data systems that follow from birth to death, essentially, and they can look at things like long-term intergenerational effects of government policies or conditions. I want to just echo the comments made by my fellow panelists about the challenges of data sharing, and these are something we have to recognize with these longitudinal data systems. So who owns the data, and what happens when we want to connect with other data that's outside of the education system, like, as Carlos mentioned, the criminal justice. Data sharing has been an impediment to the growth of these longitudinal data systems, but the nice part about a system like this is we standardize it, we get these things figured out, we can standardize it, and then it can be a uniform procedure for researchers to access it without having to do it 1,000 different ways for every researcher. So there are lots of advantages of having robust longitudinal data sets, but of course it's not without its drawbacks. As Carlos mentioned, privacy is a concern. Fortunately, states have done a nice job, from what I've been able to see, of protecting data sets through careful, thoughtful policies and management standards. that Carlos did a really nice job of describing. But we can't get complacent. We have to maintain diligence on that front in order for these to be useful. Another area of improvement is one for coordination. Longitudinal data sets don't always have the data that researchers want. And the other side of that coin is that researchers are not always asking the questions that are the most interest to state policymakers. And so I think there's a lot of room for collaboration on this front. But I'm really optimistic that there is great potential in these data systems to begin to crack some of the thorniest problems that we face in policy. And my hope is that we'll continue to work together as researchers, government policymakers, and other interested stakeholders to ensure that these data sets are available and able to be used to improve the lives of the citizens through better policy. So I think with that, I'll stop there and leave opportunity for people to ask questions.
Thanks so much, Dan. I'd like to invite all of the panelists back so that we can have a little bit of conversation among all of you. So our tech folks will handle that, I think. I wanted to give Dan just another minute to plug the executive education.
Oh, they're going to fire me for not doing that. Yes.
No, because this panel is a conversation, but the School of Data Science is also offering an executive education workshop on exactly this topic of bridging data and policy. So I want to give you a second to talk about that, if you would.
Yeah, absolutely. Thank you for reminding me. Yes, we are. We've organized an executive education that's really designed for people who are interested in understanding how we go from data to policy, but don't necessarily know all the technical details. I specialize in intuitive, getting people up to speed in a sort of data literacy way to understand how we go from point A to point B. I would love to have, if you're interested, I'd love to have you in class, because I want people to feel comfortable feeling like they can tackle these sorts of questions and understand what other people have done to make these useful answers.
Great. So anyone interested in that can certainly go to the data science website and look under executive education to see the next offering. I think it's being rescheduled right down.
It is, and yes, and I can't remember the date of it, but it's in the spring, in March, I believe.
Perfect. So plenty of time for people to consider that. All right, so let's take some questions. I want to give all of you a chance to ask each other questions. Yeri, did you have anything you wanted to say, since you went first and have been kind of chomping at the bit, I'm sure, to respond or ask about what you've heard?
I guess the main question, I think all of us spoke about the challenges of data sharing and the trust and relationship building that it takes to make it happen. I was curious in terms of what has that looked like in terms of timelines in your work or for different projects? Because what it seems like in my experience is it could take quite a long time to establish that foundation, like the data governance and structure and systems. And sometimes people change, right? Like who comes in, especially if you're working with larger institutions, does it mean has that affected your timeline, or how have you managed this kind of changes in being able to keep the work moving forward?
I'll speak to that. I'll speak to that very briefly. It takes a long time, and you have to be very patient. This is. I'm thinking of the Virginia longitudinal data system took several years before it was up and running in a way that could be used, and part of that was there's this negotiation on both parties to make sure that each is meeting the needs of the other. I have a colleague, Jim Wyckoff, who worked with DC public schools, and it took years for them to establish a relationship where they felt comfortable sharing, and then allowing him to publish outside of, to a broader audience. Even after they had data sharing in place, they didn't always feel comfortable with him sharing his findings outside of DC. So it does require patience, and I totally get that. I understand why that's the case.
So I call it herding cats, because they all want to do their own thing, but you're trying to kind of nudge them all to the same general direction and ultimately bring them all into some point of convergence where then the value is generated. And a lot of folks, when you talk about data sharing, they kind of focus on the technology first because they think that that's the largest impediment, and it's not. It's the easiest thing to implement. It's really the people and the process side of the house that really, require the most attention. And of those two, people is the largest one. It takes the most attention, most energy, most amount of time. So when you talk about these data sharing agreements, especially when you're talking about like point-to-point sharing agreements between two entities, they can sometimes take 6, 9, 12 months to kind of work through. And that's just the legal agreement. That's not even sharing the data, understanding it. No, that's just the legal framework. And so that's why for us, we really wanted to focus on establishing a consistent data sharing environment, data sharing framework, so that we don't have to revisit that. Because the more partners you get into the mix, the more nuanced, the more idiosyncratic the legal framework becomes, and then it doesn't work for anybody, right? And being very careful with that, doing the homework up front pays dividends.
Yeah, thank you for that. I bring that up because I realize sometimes it's like the battle of being proactive versus always responsive to, like it takes you're working so hard on these big picture goals. You can't be as proactive and so it's kind of tough, like finding that balance, but that in the long term, hopefully with all of these things in place, it'll be much easier. But yeah.
And I think the key is really working on small, right? And I think someone mentioned it. I think, was it you that mentioned like starting small, doing small things? Because you can think in long term, like this is how I want it to be, but you have to do it in small chunks at a time. Because if you don't, you get into that boil the ocean kind of, a mentality where people think you really need to have all of this done before you can have any value out of it. And that's not true. You can start generating value in small chunks and start building up momentum and critical mass as you go along.
Carlos, when you were talking, I was very struck by, I guess, the complexity of the governance and the management and the communication. And it sounds very resource intensive. And I was wondering if you and the other panelists could talk a little bit about the resources that are required to implement adequate data sharing, data management, and how that might impact, for example, municipalities that are more resource poor, and whether that creates disparities in knowledge about communities that are less privileged.
I totally agree, Claudia. It does take a lot of people to make this thing work. And, whether you're talking about data stewards or data owners or data custodians at the technical level, there are still people that need to be engaged. And when you talk about municipalities that, there are municipalities that don't even have access to a GIS person, right, to help them manage their parcel layers and things like that. And that person shares the responsibility, for GIS with IT and networking and telephony and all kinds of stuff. And so that becomes very, very difficult. But, you have to identify, you don't necessarily have to identify an individual whose only job this is, but you have to identify individuals that have an affinity for this, that would be willing to be engaged in the conversation, that are at the right level. And so there are different levels. As we talk about organizational hierarchies, strategic, tactical, and operational, you still need those three different levels represented. And the amount of time each one participates in the governance framework is limited. And you can manage that. But again, it's like if you're resource limited because you just, don't have the revenue that some of the other counties have, it's going to be hard. It's going to be very, very difficult to implement an appropriate governance framework. Absolutely.
It's a real problem because as we just talked about, it takes a lot of time to establish the foundation and build relationships. But a lot of smaller municipalities find these pockets of money and do a proof of concept, right? They have a small window of time to test out their theory and then be able to then advocate for more funds or more resources, more people to work on these projects. And so it's a fine line, it's a hard balance. And so sometimes it's easier to try and build off of existing relationships, but then it's like trying to think about, is it really going to get at what you're trying to get at? And then it depends on if there's a technology element. A lot of places have very customized data management systems that do not speak well with each other, that require like people who have really worked with it, for a long time. It's like, so it can get messy. And it's like figuring out what's the right chunk, the right people, the right time frame with the right pot of money that would allow you to be able to then scale it up. And that's kind of a balancing act. And some people are really good at it and others really struggle with that because you have to really understand all those elements.
Thank you.
And can I just speak really quickly that I think one of the advantages of having state longitudinal data systems is that there is a standard way of providing the data that's, we're not relying on every municipality or in my case, school district to have their lawyers look through this. You have something from the state saying, here is the thing that we've established. Here are the data we need from you. And that just makes it easier for everyone, I think, and does allow us to make sure that we're including the small rural school districts that might not have the same data storage capabilities or even the right person to know how to work with researchers who approach them.
Thanks. We have a couple of questions that have been submitted by the audience that relate to the, not surprisingly, to the pandemic. And there are at least two that I'm seeing here. One has to do with whether the pandemic has pushed more local or state governments to invest in and share data for, in this case, for healthcare purposes. And the other question is, what is your top recommendation for bringing order into the chaos of COVID reporting so that it can be used in a sensible way to make decisions, for example, about opening or shutting down schools? So one or both, if you have any thoughts about what you've observed in terms of municipalities responding to the need for COVID data, and what you'd like to see so that that data can be used to make decisions, right? I think a lot of the pandemic is, we talk in data science about the infodemic, right? Of so much information and no one really sure how to interpret it or what it means. And I think that it's a real crisis moment for decision makers too. So,
Dan, you should go first.
No, I was going to say Carlos is the one who knows the answer to this. I'm just listening in.
I'm more than happy to jump in, but I wanted to give you guys an opportunity to just go ahead and say.
No, I'd love to have your perspective, actually.
Yeah. So, I mean, yeah, absolutely, right. It's definitely brought us a lot closer and made data sharing a much more relevant topic. I mean, obviously, the government and the General Assembly have recognized that data sharing analytics are important to the operations of government. And 2 years ago, they wrote in the legislation, created this position, hired me. So they already knew that this was important. But how do you trickle that down to the agencies and the organizations that actually have the data in their possession, right? And make that data accessible. Now, BLDS is a great example because they've been doing this for 9 years, but it's a very small, relatively small when you talk about the Commonwealth government services, because they're really looking at educational services and employment outcomes, right? And that's a very constrained approach. Right now, it's about 12 different agencies that have been involved in that. Now, if we were to turn to the BLDS right now and say, okay, give me all your data and how can I use it to respond to COVID? There's nothing there, right? There's nothing for us there from the health space to be able to leverage that. And so having that knowledge learned and be able to build in that data trust brings in all of those different partners in a much faster way. So we were able, so just to give you a point of reference, and we all have data sharing experiences with legal frameworks and stuff. I was able to get VHHA, which is the Virginia Hospital and Healthcare Association, a private healthcare association, into the data trust within, from the time that they first saw it to the time that they signed it was less than a week. And from the time that they signed it to the time that our first dashboard, the first data set came streaming through was a day. And then from the time the first data set to the first dashboard was 6 days. I mean, that's pretty phenomenal. And that's because everyone understands that we are dealing with a monster and we need to come together to address it. And so now that we have this experience and people have been coming to the table, we're leveraging that to bring other agencies into the data trust. And then at the same time, to address question number 2, is start standardizing how we're reporting this and then federating some of those restricted data into the open data portal at an aggregated level. Right? So although internally we're leveraging things at a person level or individual level, but we know we can aggregate up to either locality, health district, health region, export that directly to the open data portal, and then make that available to the public for their consumption. So, it's going to take a little while and we're working on it, but, herding cats. Herding cats is difficult.
Yeah. Well, viewers who are interested in health data might like to know that the iThrive network that is in part sponsored or led by the School of Data Science consolidates electronic health records across the Commonwealth from all of the universities and health systems. And our founding director, Don Brown, is one of the directors of that initiative. So it's definitely something ITHRIV to look into if members of the audience are interested in that sort of information. Again, that's an example of very protected information that is shared across these health systems for researchers to be able to use to understand crises like COVID. Dan?
Can I ask a quick question of Yeri? Actually, when you were talking, I was intrigued. Have you experienced places that interpret HIPAA in such a way, are there different interpretations of HIPAA and what can be provided to researchers? The reason I ask is that we do encounter that with FERPA, which is the kind of education equivalent of HIPAA, where some states interpret it one way, other places, and I'm just curious how you dealt with that. Yes.
The short answer is that people interpret it differently. It's interesting, actually. I actually see it also with my current job. So when working with the health systems, and especially in Cincinnati and health departments, all that stuff, it was a lot of back and forth between their lawyers and their systems themselves and trying to determine like what made sense. I stayed out of that one a little bit just because it felt like really in the weeds. But in short, yeah, it seems like different systems or different states actually interpret those rules a little differently. And so you have to be intimately familiar with how you structure your systems and like how it meets every piece of, HIPAA, and then being able to defend that and help them, and then try and hear how they interpret it, and then be able to like counter that and like, well, it's still meeting HIPAA because of blah, blah, blah. But yeah, that's another challenge with like these different security measures in place. It's like everyone is also reading it slightly differently or process. Yeah, so. Yeah.
In my experience is they're not as concerned about the data getting out. It's more like, I don't want to be in trouble for sharing something I wasn't supposed to share.
Yes, exactly.
So it's all more compliance, but great.
Thank you, Yeri. Thank all of you. We do have to wrap it up because we have a tiny break before our closing keynote today. So I want to thank all of you for sharing your insights today, and thank all of the audience for joining us. And I hope that everyone will pay attention to these issues on our website and sign up for the executive education program, and also just be more aware of efforts in the Commonwealth and across the country for data sharing and data responsibility. And thank you all again. Have a great weekend.